50% of our portfolio is allocated to life science investing. And if you look at life science investing and you look at Asia, then clearly India is a place that offers opportunities the like of which probably don't exist anywhere else. So when I joined, we had offices just in Copenhagen, Boston, and San Francisco. And today we're in Singapore, Shanghai, Mumbai, London, Copenhagen, Boston, and San Francisco. We also felt that certain manufacturing competencies are very advanced here, and so we recently made an investment in Schott Poonawalla, as you well know, which is a pharmaceutical packaging company. AI-enabled X-ray diagnostic imaging based out of India. So not surprisingly, I would say that healthcare IT, health tech out of India is proving to be very competitive on an international basis.
He leads Novo Holdings, one of the world's most influential life sciences investors, overseeing a €150 billion outlay that spans from global pharma to breakthrough biotech. Today, here at the Raksha Summit by MediAssist, in collaboration with the Economic Times and the Boston Consulting Group, Qasim Kutay brings a global lens on what it will take for India to build a healthcare system that is trusted, that is predictable, that is low cost but high impact. Qasim Kutay, CEO of Novo Holdings, welcome.
Thank you. Pleasure to be here.
Real pleasure for us to have you here. So welcome to the Economic Tidies. You've really stepped up your investments in India,
Yes.
right? Across genomics,
Yes.
hospitals,
Yeah.
digital health, manufacturing.
Yes.
Beyond India's size, what was it that changed structurally, that made you aware that India is a strategic market rather than just an opportunistic one?
Yeah. I think it's probably three factors. I mean, our step up is not just because something structurally has happened here. It was just a question of us gradually expanding as we wanted to do. So after I joined as CEO in 2016, there was clearly a desire from my end and a board that was new to really broaden our scope of investing geographically. So when I joined, we had offices just in Copenhagen, Boston, and San Francisco. And today we're in Singapore, Shanghai, Mumbai, London, Copenhagen, Boston, and San Francisco. So there's that very important element. And then given our focus on the life sciences, so 50% of our portfolio is allocated to life science investing. And if you look at life science investing and you look at Asia, then clearly India is a place that offers opportunities the like of which probably don't exist anywhere else in the region. With the push to diversify geographically with the opportunity offered in India, it was a very, very natural place for us to open an office. And of course, we started investing in India well before we opened the office in Mumbai. But now that we have feet on the ground, so to speak, there was clearly a desire to do a lot more.
All right. So, you have a portfolio which touches now multiple layers of this ecosystem. Has your investment approach changed as you've gone deeper and wider into the Indian healthcare and pharma ecosystem?
Yes, I would say a little bit. I mean, I think, as we now spend more time here, as we have a team on the ground, you start getting a little more attuned to opportunities and trends and begin to think about things that perhaps you wouldn't think about if you weren't locally present. So when we first started investing, no surprise, we invested in probably one of the most common and areas and very high growth and very sizable area where you see a lot of foreign investment, which is the big hospital groups. But as we've spent time on the ground now, for example, we have realized that single specialty hospitals could be a very, very interesting area. So that is an area that we're increasingly looking at. We also felt that certain manufacturing competencies are very advanced here. And so we recently made an investment in Schott Poonawalla, as you well know, which is a pharmaceutical packaging company. So yes, I think, of course, you can observe and see some very interesting opportunities when you're outside, but once you're here, it does change your perspective somewhat and adds a nuance to it, which perhaps you wouldn't have if you weren't locally present.
All right. What was the real turning point for you? Was it like finding the operational depth, finding founders, for instance, and operators who could scale responsibly in a very fragmented healthcare ecosystem?
Yeah, I think you've hit on the two most important things in terms of teaming up with the right promoter and the right team, and then scaling responsibly. And we are very, very focused on the responsible components. So as a company with long-standing rooted Danish values, owned by a foundation that is very sustainability focused, ESG focused, the way we do business and how we do it, and the sort of due diligence we do with respect to ESG is very important. So I'm really glad you asked that question. I think, India, I always say the macro is very easy to understand. Right? We're an investor in MediAssist. You see the name there. You look at health insurance in India, where it is, and you look at what's going on in terms of GDP growth, that's only going to go one way. The challenges in India is not the macro story. That's very easy to understand, and the business plans very often are very easy to understand. What you need to make sure that you get right is going in at the right valuation multiple. There's a lot of great things about India are priced in, so we find that a big challenge. And then number two, exactly right, with making sure that you are teaming up with a promoter that is, and with a team that are willing to scale responsibly and are attuned with some of the values that we hold dear.
Now that you've spent some time in India, which are the areas that feel globally competitive, and which are the areas you think that still need work?
So, first of all, global competitiveness for us is not a necessity when it comes to investing. So if you look at some of the hospital groups that we've invested in, they are very much in India for India. We're not investing in them for international expansion. We're invested in these companies to help them scale and grow in what is a huge opportunity domestically. So I think this global competitive point is not one that we're very hung up about, because the opportunity within India itself is just so immense, right? A 1.5 billion population where GDP is growing at 5% plus on a very consistent basis, and frankly has room to even accelerate if certain things are done right on a policy perspective. So nice to have global competitiveness, but it is certainly not a key factor when we're investing. There are areas, however, where we have been very impressed by the global competitiveness of India, and where we have invested in companies that are beginning to have a global impact and are beginning to work more internationally. And it should come as no surprise that a lot of those have a big technology bent. So MedGenome, as a diagnostic company focused on molecular diagnostics, genetics, with the incredible database that they've built and having access in Bangalore to the data scientists they do. Yes, it's primarily a local play, but increasingly it has an international angle to it as well. Cure.ai, maybe another company that you're aware of, one of the world's leaders in AI-enabled X-ray diagnostic imaging based out of India. So not surprisingly, I would say that healthcare IT, health tech out of India is proving to be very competitive on an international basis. Of course, the other area where India remains incredibly competitive is on the pharmaceutical side. Of course, mostly small molecule today and generics, but we are beginning to see the beginnings of a biotech sector, and I expect India to remain very, very competitive on the generic pharmaceutical side.
Challenges?
Look, challenges are it's the two big things, right? I mean, it's the bureaucracy and the red tape, and just sometimes it takes a long time to get things done much quicker than it should, and of course, infrastructure is not an easy thing, and in a place like Bangalore, cities that have been so successful, that have grown so fast, where infrastructure has just not kept up with the growth in the economy. So, and this is what I referred to earlier when I said a country whose GDP is growing easily at 5% plus, but can do even more. So if these challenges are addressed, maybe 7-8% plus wouldn't be a surprise one day.
All right. When you place India alongside, say, China, other Southeast Asian countries, how does it compare when it comes to, say, stability, talent depth, and ecosystem maturity?
Well, I think the comparison is only really valid between India and China because, the other countries all have their advantages, obviously all have very important things to offer, but from just a sheer size and scale, those are the two countries with 1.5 billion people where healthcare is a true priority for the government. They both actually offer opportunities in the same and in different ways. I would say an area where China has really taken off, and the speed at which this has happened has surprised many, although it shouldn't, because everything out of China seems to happen at a very fast pace these days. But it's a catch-up on biotech. I mentioned earlier that India is very strong on the small molecule side, but not on the biotech side. But what India has done on the biotech side is truly astounding. I mean, just it's all happened in the last 3 years, where they are now an absolute major player, company that is discovering and developing some of the best molecules in the world, potentially best-in-class molecules for certain diseases, and it is therefore not surprising that a lot of the product acquisitions that have taken place over the last 2 years have been Western pharma companies buying the ex-China rights of those molecules from Chinese biotech. So I would say the biotech story, when you're talking healthcare in China, is the one that is truly phenomenal. Obviously, there's a lot of other areas to talk about, the success of their EVs and the car manufacturing, but at a life science level, I would say the biotech revolution in China is truly impressive.
All right. What lessons can India take from China in that regard?
I think the speed and the resoluteness of focus on execution. So once a path is set, and innovation is deemed as an absolute priority, biotech is deemed as an absolute priority. The meticulous focus on execution and delivering on that is not just a lesson for India. I mean, this is not for India. This is frankly a lesson, for all of us. And so we can all learn from the execution, the quality of execution that takes place there. And then, of course, what they've done on the infrastructure is absolutely astounding. It is truly world class. What they were talking about, roads or airport, their train system is just phenomenal, right? I mean, I was asking somebody today, how are you going back to Bangalore? And then I realized what a silly question, because by plane 1 hour. But just out of curiosity, I said, do you ever take the train? He goes, no, it takes 20 hours. How can a train from Bangalore to Mumbai take 20 hours? So obviously what they've done infrastructure-wise is very impressive.
Yeah, so India needs to play catch-up.
Well, I think infrastructure, but that's exciting. You see, this is where it's an opportunity, right? I mean, if you want to put money into an economy and stimulate an economy, there's no better way to do it than an investment that is going to yield highly attractive
exponential returns.
And I think I would argue, I'm not the Indian economist, but it would seem to me that investing, and I know a lot of investment has happened. I mean, what I fully appreciate in India actually is the fact that, we have infrastructure today in India that places have infrastructure that, 15, 20 years ago didn't have any infrastructure. So we should not forget the incredible progress that's been made. But it strikes me that the return on investment in infrastructure in India is a very, very exciting opportunity.
All right, focusing again on India, what convinces you, last set of questions now, what convinces you that India is on the brink, or Indian healthcare sector is on the brink of its next phase of growth?
Oh, I mean, you've got the largest population in the world that is growing, a growing middle class. You've got the number of over 65s growing at an incredible pace, and the provision of healthcare has still got such a long way to go. So on top of the fact that you've got a growing population and aging population, and you've got GDP growth, you have so many parts of India, because of the issues of rural accessibility, etc., that are still not getting the right level of healthcare provision. But all of that is going to catch up, and so the opportunity is just so immense. And the reason I keep on coming here is aside from the fact that I love this country, is just the business opportunity and the quality of the management. And I have to say one thing, the quality of the management teams here of the top tier companies is as good as anywhere in the world. And it's a real pleasure to be doing business here.
All right. If you had to choose one defining driver between interoperable health data, affordability, specialized care, or scientific depth, in the context of India, what do you think will shape the next decade?
I think what will really shape the next decade is the broadening provision of healthcare, of the ability to touch more people with quality care. And of course, the insurance industry has a very important role to play in that. Again, referring to MediAssist here, as we can see the logos behind us. But I think there is a maturation taking place, and I think there is greater knowledge and awareness in the healthcare community, in government, about the importance of making sure that we have health equity, that it's not just those who can afford it in the urban areas who are able to benefit from modern advances in healthcare, and that we all have a responsibility to make sure that healthcare is equitably distributed. And I'm cautiously optimistic based on discussions I've had, and the fact is one of the things that I'm going to touch upon in my talk today, that's going to happen in India.
All right. India has one of the highest out-of-pocket expenditures when it comes to healthcare. And this is now my last question to you. Apart from everything that you have mentioned, you specifically focused on bureaucracy and red tape. On the risk side, what is the one structural vulnerability, that global investors still underestimate when they come to India?
I would have to say that certainly in terms of the opportunities we look at, and again, perhaps forgive me if I'm being somewhat myopic, because I see things very much from a life science healthcare lens, but I would say, the two thing, the thing that really we scrutinize the most is trying to justify the valuations, and just making sure that these business plans can deliver on those growth rates. There is really very little room for error. You're paying absolute top dollar because it's a highly competitive market. You have strategic players wanting to acquire in India. You've got all the big private equity players here. The big guys have raised a lot of money for their Asia funds. A lot of it is going to be dedicated to healthcare. So really developing a relationship early on with the management teams, with the promoter, to understand every lever of growth and angle and how you can maximize that. Otherwise, you can look at a lot of stuff and not be able to invest. The valuations are rich, and you've got to find a way of getting there.
Right. Qasim Kutay, what a pleasure to have you here with us. Thank you very much for touching on so many aspects, that influence India's healthcare, pharma, biotech sector.
Thank you so much for your time. Really appreciate being here.
Thank you.
Thank you.